So good morning, everyone. Governor Lamont, our health center staff, members, and our board, some of our members of our board, members of the Fairhaven community, members of the press, welcome to Fairhaven Community Healthcare. So I'm Dr. Suzanne Lagarde. I'm the CEO of this health center, and we're thrilled to host all of you here today. We okay? Good. We're going to be hearing shortly from our governor, who's going to share some exciting news about Access Health CT, the extension of the enrollment period, and the covered Connecticut program. I'm not going to go into those details. I don't want to steal Governor Lamont's thunder, but I'm going to say how grateful we are here at Fairhaven for the efforts of Governor Lamont and his administration to ensure that as many residents of Connecticut have access to high-quality care as possible. I believe firmly that this administration is making it clear that addressing equity is a top priority, and we're really grateful. Governor, it is particularly auspicious that you come here today because we are on the eve of the National Health Center Week. Every year, the second week of August, the 1,376 health centers in this country come together to celebrate the incredible work that health centers do nationwide. I want to just take 2 seconds to share a few statistics. We've been in existence for 56 years. Not we Fairhaven, but health centers in general. They came into being 56 years ago. Just an interesting point that I'd like to share. Given the gridlock that we all see in Washington, D.C., and know only too well, it's hard, at least for me, to believe that in 1964, in Lyndon Johnson's administration, health centers came into being, Medicare came into being, Medicaid came into being. I think that's truly remarkable given all of the challenges we face today. In the calendar year 2019, health centers nationwide served over 29 million unique individuals. And since the start of the COVID pandemic in March 2020, health centers have played a pivotal role in preventing, treating, and responding to COVID. Here at Fairhaven Community Healthcare, we've performed over 75,000 COVID tests, and to date we've administered over 23,000 vaccines. We were part of the state's Care Partners program, and in that capacity we worked with the Department of Health to perform weekly COVID testing in 8 local nursing homes, including our own Mary Wade home here in Fairhaven. In partnership with local businesses such as M7 Taxi, we've delivered over 100,000 pounds of food to members of our community suffering with significant food insecurity. And we were able to do all of this because of the strong support and true partnership of our state leaders. One of the crises we're now facing, and as everyone knows, we've certainly all faced our share of crises over the past 18 months. One of our current issues is access to affordable health care for our community. We at Fairhaven Community Healthcare are responsible for over 28,000 patients, more than 25% of whom are uninsured. While we can and we do provide high-quality care to all who walk through our doors, we're challenged with our uninsured and our underinsured patients when it comes to getting them specialty care, getting them the costly medications that they need, and also these uninsured and underinsured patients avoid visits to the ED even when they're needed because of the astronomical costs. Access Health CT and now the Cover Connecticut program are steps towards lessening these barriers, and I welcome the news we're about to hear. So, without further ado, I'm going to turn the podium over now to our next speaker, who is Mayor Justin Ellicott. Thank you very much.
Thank you, Dr. Lagarde, and thank you, Governor, and so many other people here that have supported New Haven throughout this past year and a half. And I also noted that Representative Paolillo has joined us as well. I wanted to take a moment to talk about how our partnership with community groups like Fairhaven Health has been vital to us responding to helping support people, in particular the uninsured and people that struggle to get access to health resources. And that has become just incredibly evident over this past year. The importance of groups that serve the community regardless of document status, regardless of their economic status, regardless of where they come from, is vital to the success in us combating all the health issues that we face that impact us all. And COVID-19, I think, has been one of the clearest examples of that. So, when I think about the leadership of community groups like Fairhaven Health and Dr. Lagarde to ensure that New Haven's been at the forefront of responding to the pandemic with testing, with vaccines, and thinking of creative ways, always pushing the envelope and pushing leaders like myself and the governor to think differently about how we're approaching the pandemic and other health issues. I'm very grateful to have you in this community. And for the governor, there's a reason that Connecticut has overall been very, very successful at confronting the pandemic, and it's because we have consistently had leadership that has followed the science and been strong, been direct with the public, been honest with what we need to do to accomplish a response to the pandemic that keeps everyone safe. And so, Governor, thank you for wherever you are. Thank you for your partnership. You always answer the phone right away when we need something in New Haven, and I think that yet another example of that is us asking for more authority on masks, and I appreciate you giving us that leadway. Grateful for your partnership as we move forward. And this is another example, not just of COVID-19, but beyond that, of how we as a community can make sure that more residents have access to health care that benefits not only those residents that will have newly found access to health care, but so many others. So thank you, Governor, and I'm going to hand it over to Vicki Veltri.
Good morning, everybody. I'm Vicki Veltri. I'm the Executive Director of Connecticut's Office of Health Strategy. Very happy to be here this morning with our governor and other leaders of the legislature and leaders of like Sue Lagarde, who I've worked with for a long time. I just want to make a couple comments because we don't want to get into all the details right now, but very happy to be administering a program that offers health insurance, free health insurance to up to 40,000 people in the state of Connecticut. Governor Lamont has made a commitment over his tenure, and Connecticut has been laser-like focused over the last 10 or so years about taking every advantage we can of the Affordable Care Act. Federal money is coming into this state to expand access to care for people in the state. We continue to do that. We will be focused on that, and at the same time continue to be focused on bringing down health costs, as we know that continues to be a barrier for the residents of our state of Connecticut, while continuing to provide high-quality health care. So I don't want to mention a lot of the details. I want to save those for the governor, but just to say that I am very happy to be working with a team that includes Access Health, with our Department of Social Services, with our insurance department, our legislative branch, and obviously Governor Lamont to deliver high-quality, low-cost, and no-cost health care to the residents of the state. So thank you very much, and with that, I'm going to turn it over to James Michel.
Good morning. I'm James Michel, the Chief Executive Officer for Access Health Connecticut. Thank you for being here today as we share an update with you and the governor. As you know, we have yet to emerge from the greatest threat to public health in a century. And access to health insurance has never been more important. That is why we are excited to announce that the special enrollment period has been extended to October 31. It was scheduled to end this on the 15th of August. We are moving it to October 31, giving Connecticut residents more time to shop, compare, and enroll in a quality and affordable health insurance plan. Our annual enrollment period starts the very next day, November 1st, 2021, for the 2022 coverage. We are also happy to share that the deadline to enroll in the Cover Connecticut program has been extended to December 31st. If you or anyone you know does not have health insurance, please, I beg you, get them to get in contact with Access Health Connecticut immediately. The American Rescue Plan, signed into law by President Biden on March 11th, has provided new financial help, making health insurance coverage more affordable for many Connecticut residents. It helps reduce the cost of health insurance by virtually eliminating or vastly reducing monthly payments for many people with low and moderate incomes. And it provides new financial help for people with higher incomes who can face high monthly payments. In fact, the residents of Connecticut are saving an additional $5.5 million every month since the American Rescue Plan went into effect starting on May 1st earlier this year. And nearly half of all Access Health Connecticut customers are paying less than $50 per month per enrollee for their health insurance plan. Access Health offers free help if you need to shop, compare, and enroll in the health insurance plan. You can connect online at accesshealthconnecticut.com and click on the live chat icon to connect with one of our customer service reps. You can work with your broker. If you don't have a broker, our website will give you directions to a broker closest to your home address. And you can get free help at our Navigator partner locations, One Project Access right here in New Haven, and also the community renewal team. Additionally, you can call our call center at 1-855-805-4325 from Monday through 8 a.m. from Monday through Friday from 8 a.m. to 5 p.m. If you have trouble hearing, you can use TTY at 1-855-789-2428, or you can call with a relay operator. We are here to help Connecticut residents. Connect with us to see how much you could save. If the pandemic has taught us anything at all, it is how important our health is to all of us in our community. Thank you very much. At this point, I'm going to announce Brendan Russo from Anthem, Connecticut. Brendan.
Thanks, James, and thanks to Governor Lamont for having us here today, or Governor Malloy for having us here today. Sorry, Governor Lamont. Little brain's a little messer. I didn't have my coffee this morning. But anyway, I'm Brandon Russo from Anthem Blue Cross and Blue Shield, Sales Director. Happy to be here today, and we're very excited to be a partner with both Access Health CT as well as all the other partners that we have here today. Really excited about the Covered Connecticut program and how it's going to provide access to health care for a number of individuals that don't currently have access today. And Anthem Blue Cross and Blue Shield is certainly a proud partner when it comes to that. If you have any additional information, James just mentioned all the resources that you have through Access Health. We just highly stress and encourage you, for anyone that is interested, anyone that you know that does not currently have health insurance, obviously to access the Access Health CT website. There's a lot of great information out there and resources. So again, we're just happy to be here and be a part of it. And again, thank you, Governor Lamont, for having us here today. And thank you all for being here. At this point, I'm going to turn it over to Eric Galvin from Connecticure. He has a couple words he would like to say as well. Thank you.
Good morning. Thank you for being here. Eric Galvin, I'm the president of Connecticure. And, first and foremost, I'm out here to encourage anyone who is eligible to please go find the resources that James Michel mentioned and enroll in this great program that the governor and the rest of the state came together to offer. We've been very proud to serve 8 out of 10 of the people who are in the individual market here in Connecticut. Our mission as a company is to make healthier futures for the people that we serve. And we have a 40-year history of partnering with the state. So when the Department of Insurance and Vicki and her team called from Office of Health Strategy and said, can you help us make this happen? We said absolutely. That is the only answer. So again, really encourage everybody, take advantage of Covered Connecticut. And with that, I'm going to turn it over to Senator Looney.
Thank you. Thank you, Mr. Galvin. Appreciate that very much. This is really a great day in Connecticut. I want to thank the governor for his leadership on so many issues related to health care. The Covered Connecticut program is going to make a huge difference in extending health coverage to many low-income people in the state of Connecticut by providing premium supports and assistance with health care coverage in a way that is going to make a dramatic difference, not only in people's health care, but also in their levels of anxiety about health care. And that's also an important factor to be dealt with here. A couple of other things I would just like to acknowledge. So fellow legislators who are here, I think Senator Lesser, who is our chair, Senate chair of the Insurance Committee, has done a superb job as an advocate for consumer-oriented health insurance. Representative Scanlon, the former chair of that committee and now House chair of the Finance, Revenue, and Bonding. The 3 legislators who represent the service area of the Fairhaven Community Healthcare area, and that is Representative Al Paolillo, who is here, Representative Juan Candelaria, Representative Roland Lamar, all of whom have been strong advocates for this health center and for the the major significant grant that we were able to secure in this year's budget, which will be $10 million for the construction, the addition of the health center to go all the way to the corner of James Street, and the purchase of the building on the corner, expanding the service area of this great facility. There are a few other things I'd like to mention briefly that were significant health initiatives that were passed this year. Public Act 2196 that limits the ability of insurers to change drug formularies during the policy year. This is very important because people who buy a policy attracted to it because of certain coverage of prescriptions sometimes find out that coverage changes during the year. We won't allow that in the future. Public Act 2114 that prohibits insurers from using copay accumulator programs that prevent patients from receiving the benefits of copayment assistance programs and discount cards, and Public Act 2129 that updates and expands existing hospital billing protections to ensure patient protections apply not only to hospitals but to hospital-owned entities, which we know have been expanding. In addition to that, we had Senate Bill 1, which establishes the important principle of recognizing racism as a public health crisis in Connecticut, and Senate Bill 2, improving access and health care for children. I want to thank the governor for his advocacy on these, my legislative colleagues, including Speaker Ritter, without whom obviously this could not have happened, and a special acknowledgement to Dr. Suzanne Lagarde, who is a bright light for healthcare in the state of Connecticut, and this community health facility is literally a lifesaver for so many low-income and uninsured and underinsured people in the state. So it's our great pleasure to be able to advance their cause with this legislation this year. Thanks very much.
Good morning. I'm Sean Scanlon. I'm the former House Chair of the Insurance Committee. Now I chair the Finance Committee, as Senator Linney just said. And I'll be very brief and just say that if there was one truth that we unfortunately learned the hard way during COVID, it was that people who did not have frequent access to medical care and who had things like comorbidities, if they contracted and when they contracted COVID, they would undoubtedly get much sicker, and some cases, unfortunately and tragically, die because they were not able to have access to regular health care. This will allow them to do that because it will make it more affordable for upwards of 40,000 people in our state to be able to finally afford the health care that they deserve. It's a human right. Now they'll be able to access it in places like here in Fairhaven, in New Haven, and all around the state, thanks to this law. And I couldn't be prouder to work with the governor and my partner, Senator Matt Lesser, in this effort to get this bill passed, sign into law today, and out there in the people, for the people of Connecticut. So turned over to Senator Lesser. Thank you.
Thank you, Sean, and I'm here with my chief of staff, if you give me 1 second.
Good morning. I'm Senator Matt Lesser, and I just want to echo the words of my good friend Sean Scanlon, as well as the folks who've spoken before me. This is a really big deal. Over 10 years ago, Congress and President Obama passed into law the Affordable Care Act, which did an awful lot to expand coverage and reduce the uninsured rate in Connecticut. The uninsured rate fell by over 50%. And it's working for an awful lot of folks. We did away with pre-existing conditions. We made sure that annual and lifetime caps were a thing of the past. But unfortunately, many folks in this state and around the country ran into some sticker shock, trying to purchase plans and finding that they were not yet fully affordable, that premiums or high deductibles or high copays were a barrier to access to care. Well, with two pieces of legislation, the American Rescue Plan and with this Covered Connecticut program, things are now very, very different in Connecticut. And I think it is really important that if you have gone out and looked at a health care plan on Access Health Connecticut in the past and you did not find something that was affordable, go look again, because things are different now. I was just talking a couple of weeks ago to a woman from Danbury who's a middle-class resident, and she had been looking for affordable health insurance. And I encouraged her to go to look again, and she did. And she found a plan that was saving her $1,200 a month over what she'd been paying previously. For a middle-class family in Connecticut, $1,200 a month is a complete life-changing revelation. And there are other folks who were caught between the cracks. Those folks that are directly targeted by the Covered Connecticut program. People who made just a little bit too much for Medicaid, but not enough to afford private health insurance on Access Health Connecticut. And so what we're doing with this program, working closely with Governor Lamont and his excellent team, is helping bridge that gap, making sure that if you are in the middle, that we can give you a completely free private health plan, that there are no copays, no deductibles, no premiums. You can access the health care that you need. Because if there's one thing we've learned during this pandemic, it's that health care is something that we all need. And none of us are safe unless all of us have the ability to go to a doctor when we're sick. This is a first-in-the-nation program. There is nothing like this in the country, where we are working together, marrying Medicaid, a little bit of state support, and the Affordable Care Act to make sure that we have a continuous system where nobody falls through the cracks. But as our state's fiscal condition continues to improve, and we're hearing good and better news, my hope is that we will be able to expand this program yet further, making sure that the promise of affordable health care extends well into the middle class, so that families in this state don't have to go without the coverage that they need. Thank you. And with that, I'll turn it over to extraordinary partner, Commissioner Deirdre Gifford.
Thank you very much. Good morning, everyone. Good morning, Senator, colleagues, Mayor, Governor Lamont. Very happy and extremely proud to be here talking about Covered Connecticut. As you just heard, this program is going to provide no-cost health coverage to up to 40,000 people in Connecticut when it's fully implemented next year. How will we do that? We're going to build on our terrific Access Health Connecticut insurance exchange, which already provides low-cost insurance, but we're going to supplement on top of that for certain families with certain income eligibility criteria so that there are zero out-of-pocket costs. We're going to start that this year. It's already begun. We've enrolled 600 people in the program already, and then more people become eligible next year. So what that means is you can get access to high-quality, broad coverage through Access Health Connecticut with zero out-of-pocket costs. So as you just heard, if you're a person who's been looking for health insurance and you haven't found a plan that you can afford, go back to the Access Health Connecticut website. Try again. If you're eligible for Husky, we'll enroll you in Husky through that same website. Or if you're eligible for one of these plans, you'll learn about it. In addition, this program is going to provide some really important additional coverage that's going to improve health equity and health outcomes. I'm very proud that Connecticut is extending postpartum coverage for all women covered by Husky for 1 full year. That's been a national recommendation to reduce disparities in maternal and child health outcomes and to improve birth outcomes for both women and babies. So that's huge for us, 1 year of coverage, including women who are undocumented, who are already covered under Husky, under emergency Medicaid, but will get a full year of extended coverage under this program. The program also will cover undocumented children up to the age of 8, which is a really important public health intervention. As children go back to school, they'll be able to get their preventive health checkups and their vaccinations without worrying about the cost of care. So some of you may have seen a study that was published this week by some researchers at Duke that looked at the health effects of early Medicaid expansion. Connecticut was one of the states that was studied in that report. And what it showed is that in states that expanded Medicaid with the full ACA expansion back when it was passed, there were fewer deaths from cancer. So this is not just about lowering premium costs. This is not just about an administrative change in our programs. This is about real people and real health outcomes. So today, by expanding further, building on our exchange and building on the supports through the Biden-Harris American Rescue Plan Act that have been helping lower costs in the exchange, by building on that further here in Connecticut, we're going to save lives and improve health. I want to say thank you to all of our partners in state government. We worked very closely with the legislature on this, and I think working together we made it a stronger piece of legislation, so Thanks to everyone who worked with us. Thanks to my sister and brother state agencies. I think this is another example of Governor Lamont's directive to his commissioners to work across agencies. So we've been working with the Office of Healthcare Strategies, with OPM, and with our partner at the Insurance Department, Commissioner Mays, as well as Access Health Connecticut. Working together, we were able to bring this to fruition. So with that, I'm very pleased to introduce my colleague, Commissioner Andy Mays from the Insurance Department.
Thank you, Commissioner. I'm Andrew Mays. I'm the Commissioner of Insurance for the great state of Connecticut. Not a big fan of heat, and we're here on this toasty, warm day, but I do have to tell you, I am so thrilled to be here. Going last has its pluses and minuses, but one of the good things is that everybody's actually said what needed to be said. I do want to reiterate 2 points. If you haven't been vaccinated against COVID, please get vaccinated. There will be no protest. And the other is to take a look at Access Health. Whether or not you have existing coverage or you're looking for coverage, it's a great place to get wonderful coverage at an affordable cost. In many, many ways, or for many people, it will be at no cost or very low cost. Please, I'm here, and as Commissioner Gifford just said, we're all here working with the governor, under the leadership of the governor, and with our partners to make sure that everyone in the state has the coverage, the health insurance, the access to health that they need. And this is a great day. It's another great step forward. And for those of us who are here who have worked with this governor, I can tell you one thing. This is a governor who understands. We've heard so much about infrastructure. He knows that infrastructure is not just roads and bridges. It is the people of the state. And we have to make sure everyone in the state has the tools, has the ability, has the opportunity to succeed. We have to make sure that every person has the ability to get the health care they deserve, that no child has to go without dental care, that an older person can get access even if they can't drive or take the bus, that they can get to their care provider. That's why the governor, I can tell you, as a member of this governor's cabinet, he reaches out to us so often with ideas, with questions. And this, today, what we are here, what the governor will discuss, is one outcome of those ideas, of those questions. It is a testament to the work that the governor has done. It is a testament to his leadership. And it's a testament to bringing a great team together, both within the executive and the legislative branches. We've all worked together. We're happy to be here today. And I can tell you, I am so happy to be able to introduce the governor of the state of Connecticut, Ned Lamont. Governor.
Thank you, Andy. Did you get your drink? I'll pick up where Andy left off. It's been an amazing team effort. I want to start with Suzanne and all the folks here at Fairhaven and all the community health centers around this state, making sure that nobody's left behind, making sure that we take care of each and every one of us because we're all part of the same family. I think we've learned that over this last year and a half more than ever. Not that the people of the Fairhaven community's health needed to be reminded of that. Somebody much smarter than me, I think it was John Lewis, said, we all arrived here in different ships, but we're all in the same boat. And I think we've learned that more than ever over this last year and a half. And that's why we look out for each other. Sean said, health care is a basic individual right for each and every one of you. But as Mayor Ellicott knows, as I know, it's a public health mandate, imperative that everybody gets the highest quality health care available. Look, we've seen what a difference it makes in right here. I mean, we know that we're doing a better and better job compared to most of our states in getting vaccinated. And you say, what does that mean? Oh my gosh, I see COVID is ticking up a little bit. In fact, I see even hospitalizations are going up a little bit. But it's worth remembering that Connecticut still has about the lowest in the country fatalities due to COVID per capita, the lowest. And that is because of the good work each and every one of you guys back there are doing, making sure that nobody gets left behind. And Marty, that's what this bill that you and I worked on so hard is all about. Look, as James has said on a number of occasions, maybe health insurance is getting more affordable, but health care is not getting more affordable. And what we wanted to do here is, A, make not just the health insurance more affordable, but also contribute in terms of co-pays, contribute in terms of deductibles, make sure that everybody in this state can afford quality health care. That's just such an imperative, and we've learned that more than ever, and that's what we got to do. And that's what this bill does. That's what we have a great expansion, as Deirdre said, of health insurance. Less than 5% uninsured, but everybody's going to get quality health care. That's what our imperative is. And, I do urge, working with the legislature, we've got to continue to work together to bring down the underlying costs of health care as well. Kevin Lembo is doing yeoman's work, not here today, doing what we can to drive people to those centers where you have the best value, highest quality at least cost, and give you some incentives to do that, making progress there. Marty and I worked a little bit on a pharmaceutical bill, so the high cost of pharmaceuticals doesn't drive up the cost of health care. We've seen that in some of the rate requests, what's going on. And we tried like heck to say we're going to cap those costs, over a period of time to make sure that those are not driving up costs for everybody. And we're going to get that done in the near future as well, doing that with my friend Charlie Baker. But this is all about making sure that people remember when it comes to Connecticut, it comes to who we are. We're all a family. We're in it together. Healthcare is one of the things that we share in common. It's key for you. It's key for your family. It is key for our greater community. And that's why we're so proud that this bill is the greatest expansion of healthcare for each and every one of our citizens. And by the way, I want to remind everybody yet again, God doesn't care about your documentation status. You are part of the Connecticut family. I love what Deirdre said, in particular those young families, those moms, more moms, dads, but making sure that everybody gets the pre- and postnatal support they need to give every single kid that running head start in life. That's what we're trying to do. Thanks, everybody.